Root canal treatment, also known as endodontic treatment, is a dental procedure used to repair and save a tooth that is severely decayed, infected, or damaged. It involves removing the infected or damaged pulp from the tooth's interior, cleaning and disinfecting the root canal system, and then filling and sealing it to prevent further infection. Here is an overview of the root canal treatment process. Diagnosis. The first step is a thorough examination by a dentist or endodontist, a root canal specialist, to determine if a root canal is necessary. Common symptoms that may indicate the need for a root canal include severe tooth pain, sensitivity to hot and cold temperatures, swelling, and abscesses. Anesthesia. Local anesthesia is administered to numb the tooth and the surrounding area, ensuring a comfortable experience for the patient during the procedure. Access and isolation. A small hole is drilled in the tooth's crown to gain access to the pulp chamber and root canals. The dentist will use a rubber dam or a dental dam to isolate the tooth, keeping it clean and dry during the procedure. Pulp removal. Using specialized instruments called files, the dentist or endodontist carefully removes the infected or damaged pulp from the pulp chamber and root canals. The canals are shaped and cleaned to eliminate bacteria, debris, and any remaining infected tissue. Irrigation. The root canal system is thoroughly irrigated with antimicrobial solutions to disinfect and flush out any remaining debris. Filling. After the canals are cleaned and shaped, they are filled with a rubber-like material called gutta percha. Gutta percha, combined with an adhesive cement, seals the canals to prevent reinfection. Restoration. Depending on the extent of the damage, a temporary or permanent filling material is placed in the access hole to seal it. In many cases, a dental crown may be recommended to restore the strength and appearance of the tooth. Follow-up. After the root canal treatment, the patient may need to schedule a follow-up visit to monitor the healing process. In some cases, the tooth may require additional restoration, such as a dental crown, to protect it from further damage. It's important to note that root canal treatment has a high success rate, and with proper care, the treated tooth can last a lifetime. Good oral hygiene practices, including regular brushing, flossing, and routine dental check UPS, are essential to maintain the health of the treated tooth and surrounding teeth. Root canal treatment, also known as endodontic treatment, is a dental procedure used to repair